us about POTS. It just seems like since COVID, I'm seeing so many more people with POTS or being diagnosed with POTS. They didn't know they had POTS, right? And they just think they have these symptoms. And then, through further testing, they like that being diagnosed with POTS. So tell us more about that. What is that?
Yeah, it's
What's
a
that look like?
pandemic, right now.
Especially among teenagers. I'm seeing
Teenagers,
a
really.
lot among teenagers.
And let's just go back to here's this perfect storm. Here's the mold. Here's the Epstein-Barr. Here's the COVID. Here's the bacterial infection. It turns on the nervous system, and now we have dysautonomia. Dysautonomia has been happening for a year, and Jake, he's been in fight or flight, aka dysautonomia. He hasn't listened. And now all of a sudden, the central nervous system turns on, and now we have POTS. So it's a this. POTS didn't just happen. It developed.
Developed over time.
Correct.
Okay.
And there is some genetic reasons that POTS can happen. Okay, like I'm not going to go into all that. I'm going into this, this flow, which is POTS essentially stands for Postural Orthostatic Tachycardia Syndrome, meaning when the person changes position, their heart rate goes flutter, flutter, flutter. They get an increase in heart rate, primarily when they go from laying to seated, and seated to standing, or they bend down to get clothes out of the washer, or, let's just say they're trying to play football, trying to make all sorts of passes. They can't do that anymore. Their heart rate goes through the roof. You get these young athletes out on the soccer field and they're passing out. They're dropping dead even.
Yeah.
Because their heart beats through their chest, and they can't do the things they used to do. Why? Because their heart rate's so high. They feel like they're going to die or they pass out. So what POTS is in basic terms is, in a normal human being, all of your blood flow stays from here up. Why? Well, because your heart needs blood flow, your lungs need blood flow, and of course your brain needs blood flow, right? Mm-hmm. So with POTS, when the person stands up, all the blood flow goes down. Whoa. The blood flow drains down and the heart goes, oh crap. And it beats to bring the blood flow back up to the heart. Okay? So a normal person stands up and all the blood flow stays up. But when a person with POTS stands up, all the blood flow goes down. So this is the reason for them feeling faint, for them feeling dizzy, for them feeling brain fog. Oh, I just can't remember the things I used to. For them feeling depressed, for them feeling pain in their neck and their shoulders and having a headache. Why would you have a headache all the time, little Susie? Well, because I don't have any blood flow in my brain. Why would you have neck pain and shoulder pain? You look fine, Mrs. Smith. Well, gosh, I don't have any blood flow in my neck and my shoulders. It's all drained down. Why do I have crushing chest pain all the time? Well, because I don't have any blood flow in my lungs and my heart. It's all draining down to the bottom part of my torso. This is POTS.
Okay. So POTS, it's a growing, I like to call it a pandemic, right? Silent pandemic is what I like to call it. We're seeing a lot more of it. So how do you diagnose POTS? How do people know if they have POTS or not? Because I think a lot of symptoms you just talked about, I would say so many people can relate with that.
Everybody has them now. The thing is, there's a really simple way to diagnose POTS, and it's by simply taking, postural, checking the heart rate in a laying down position, a seated position, and a standing position. If there is a 25-point change, it's looking like POTS.
There's a good indication, yeah.
Yeah. Okay. And then if just general practitioners knew how to do those tests, which we all learn it in med school, if you learn how to do those tests, you could screen your patients for POTS. And then if there was a 25%, 25-point change, then you could refer them to a cardiologist who may or may not know how to treat POTS, but that's another story.
There's probably, very few.
Very few. But if they just did that simple screening test, they would go, oh my gosh, this person isn't having a heart attack. This person doesn't have just overwhelming tachycardia, this is POTS. Then they could transfer them to a cardiologist and they could take over from there. But that is the best test. You know, once they get triaged to a cardiologist, that can hurt you or help you.
Yeah.
Because if you go to the wrong cardiologist, what they're going to do is they're going to put you on a Holter monitor, or they're going to check your heart rate, you know, by you wearing a Holter monitor. And unfortunately, that Holter monitor is not going to alert them that, okay, Jake just stood up. Jake just bent down. Jake just turned over. It just shows little transient points of tachycardia. What needs to really come into play is there needs to be some sort of a device that could actually indicate if that person's changing positions. Then it could adequately diagnose POTS. Because what a cardiologist will do is they'll say, oh yeah, you had moments of tachycardia. I don't really know why. And they may or may not treat you for anything. But what they're usually going to give you is they're going to give you a blood pressure or a medicine to lower your heart rate, like propranolol. Let me tell you the problem with that. As a functional doctor that looks more at the root cause, I need to figure out what's causing this, not just giving them a medication to help them feel better. That's important to some people, but I need to figure out what's causing this. And if I can fix that, then the increased heart rate, all of that will go away. But unfortunately, what these cardiologists are now doing is they're giving them propranolol. Well, propranolol, what it does is it lowers the heart rate. That heart is beating fast to bring blood flow up to the upper torso. It's doing that on purpose. You can't override the heart. Well, they do. And now what we have is we have a child or an individual walking around feeling like they're not even here. I mean, they're just like, hello, because they have no blood flow to their brain. They have no blood flow. And they feel faint all the time. It doesn't help.
Okay.
Got to get to the root of the POTS, and then we can fix it.
Yeah. So, good point. I like what you said. I mean, a lot of people, good indication you have POTS is like when you're going up the stairs, you feel like you're going to faint, bend over, you go do some sort of physical activity. Maybe just even rise up out of bed. Just you're laying flat and you just get up in the morning and you just feel like you're going to pass out, or you stand up out of bed, you feel like you're going to pass out. Anything to increase your heart rate, and then you start having all these symptoms that you're talking about. How can somebody that has POTS, how can they help substitute naturally, holistically, possibly?
I think it's really important to remember what the perfect storm is that's brewing underneath. So going to someone that would be able to test for pathogens, test for toxins in the body, and then a doctor that could assess, is this person in fight or flight? And if they are, how do I get their nervous system to calm down? I think that those are the type of doctors these patients need to seek out instead of possibly, I don't want to say they shouldn't go to a cardiologist. I mean, you should, but at the same time, we've got to find a group of new generation doctors that know how to calm down colicky babies, because we have a generation of colicky babies, and we got to get them to calm down, because it's kind of it's a two-edged sword. See, there's this concept of mitochondrial hibernation that occurs that a lot of doctors are talking about now, a lot of researchers are talking about. When the nervous system is so overwhelmed and the nervous system's in fight or flight, your mitochondria, which, Jake Prince, what are the mitochondria? Do you know?
No.
Okay. We usually learn it in high school biology. Your mitochondria are your powerhouses inside of your cells. They're what keep you going. And so they're what fight cancer. You want to see if somebody can fight cancer, look at their mitochondrial function. You want to see if somebody can be an Olympic athlete, look at their mitochondrial function. And so what happens when someone's body is in fight or flight for a year or whatever, the mitochondria say, hey, dude, I'm out. I'm going to go on vacation to Bora Bora. You take care of yourself. I'm hibernating. And the mitochondria turn inward and they begin to hibernate. It's almost like they're on strike. They're not going to work for you anymore. And when they do that, the immune system sees that. And the immune system goes, oh crap, what am I supposed to do? We got the nervous system going crazy. We got the mitochondria, they're on vacation. Like, what do I do? And now we get this chaos happening at an immune level. And now what ends up happening is we get pathogens that used to be pretty benign and pretty inconsequential, like Lyme. Everybody's got a little bit of Lyme in them. Everybody's got a little Epstein-Barr in them. But when the mitochondria go on strike and the immune system start freaking out, now we can't fight basic pathogens that are in the body. And now hidden bacteria like strep and Lyme come out of the woodwork. And they go, oh yeah, this house is about to burn down. Now's the time for me to play, because we've got a weak vessel.